How quickly will your vision recover after laser eye surgery? Well, it depends what type of laser eye surgery you have. Going from the slowest recovery to the fastest recovery. PRK or ASLA, it goes under different names, where you laser the surface of the cornea, has the slowest visual recovery. Meaning you can see an hour after it's done, you can see the next day, but it takes a week to be happily back to work, and it takes 2 or 3 weeks to feel that the vision is of good quality. The next is SMILE. SMILE's pretty quick. You can see the next day, but we tell people not to drive the day after surgery. But it takes 2 to 3 days to feel the quality is good so that you can drive and do your work and live your normal life. LASIK is the quickest of all. LASIK, you're pretty good the next day, and a lot of people can drive the next day if they feel able to. So the speed of recovery depends on what type you have and also a little bit on the magnitude of error. Bigger errors will always be a little slower than smaller errors. Now you'd say, well, you'd pick the fast recovery every time, wouldn't you? Not necessarily. Fast recovery is helpful, but you should never give up or give up safety or accuracy. And sometimes, and I'll make a simple example, a thin cornea can be treated with SMILE or LASIK or surface PRK. But if you treat a thin cornea with surface laser, the recovery will be slower, but for that patient it will be ultimately safer long term. Whereas if you did LASIK, it would be a quicker recovery, but you might put them at risk of problems 3 or 4 years later. So you've got to balance speed of recovery with safety and accuracy. And that's a nuanced decision which would be individualized for you as a patient.